Good day. My name is Dr. Ryan Cormack, and I'm here to share with you 7 things that can help you to avoid breaking your tooth. This is coming from myself as a dentist, not from a dental association or any type of dental organization. This is purely individual experiences that I've dealt with that might be able to help you to minimize the chances of breaking your teeth. So this is good information to know generally throughout the year, but in particular during this coronavirus pandemic that's taking place. As dentists, we're somewhat limited right now as to the type of procedures that we can do and help you with. And as a consequence, there are some dental emergencies that we have to temporize and we can't fix it in a definitive way like we normally can. So I wanted to share with you 7 things that might help you to reduce your risk of breaking or chipping a filling or a tooth or even a denture, partial denture. So starting with number 7. Number 7 would be walnuts. I don't know if that's coming in reversed, but so this is walnut pieces. This is a bag. I've been lucky. I haven't had any walnut shells in here, so this has been relatively safe for me. But if you're one who likes to crack their own walnuts, you may find that you get a shell, and if you get a shell and you chew on it, that's not going to be very comfortable at all. So there is a risk that if you do that, you could break off a tooth or a filling. So walnut shells, definitely want to avoid those during this time. The other thing you want to be careful of, number 6, forks and spoons. Some people, they're talking while they're eating and inadvertently they bite down and they get a clang and they chip off a piece of tooth in the front. Or if there's a filling in the front or a partial denture tooth, they might break that or chip that as well. So be very careful when you're talking and eating that you don't bite into your forks and spoons. Number 5 is beef jerky. If you find that whether it's beef jerky or even a tougher cut of meat, if you're finding that you have to rip at it like a dog with its play toy, I don't know if my dog likes to really hang on to some of these toys and really grip it and pull on it. That pulling action can, especially if there's veneers or if there's fillings on the edges of your front teeth, that can cause them to debond and to break apart. If you have dentures, of course, that's a definite no-no that you want to avoid. Number 4 is hard candies. So we're talking things like Tic Tacs or candy canes or Werther's candies, Lifesavers. These are dangerous foods for your teeth. If you suck on them, they're not as bad, but a lot of people, they don't like to suck on them. They like to crunch them and chew them. That can cause some damage to your teeth or your fillings. Number 3 is things like frozen chocolate bars, frozen berries like I've got here, or ice cubes. Some people like to chew on ice cubes. That's really not a good habit, and it can cause a lot of damage. I've seen it with my patients where a filling pops out just because they bit it, ice cube the wrong way, and it just debonded completely. So please try to avoid those foods. Number 2 is Vector cereal. I don't know what's in here or what it is with this, but unless you soak it for like 10 minutes or something crazy, there's some real strong crunchies in here that can easily break your teeth really, really hard. I don't know what it is, but you may want to consider if you have to have this cereal, let it soak for like 10-15 minutes to get rid of that crunch, or maybe go with foods like Raisin Bran or Rice Krispies or Corn Flakes. You're going to be a lot safer with those type of cereals than you are with Vector cereal. And number 1, so Orville Redenbacher or any type of similar product, popcorn. So if you get a kernel or even a half popped popcorn and you bite down on it, you might be in for a bit of a surprise. You might get a really good jolt, and before you know it, you feel like there's a piece of your tooth missing or there's something not quite right going on in your mouth. and then you got a sharp edge that you're going to have to contend with, perhaps for much longer than you'd like.